name is Dr. Margaret Reiley. I'm a pediatrician in Lancaster, Pennsylvania, and today I would like to share some information with you about concussions. Let's start by defining concussion. A concussion is any injury to the brain that disrupts normal brain function, typically on a temporary basis. Concussions are usually caused by a blow or jolt to the head, but may occur from a hit to the body that produces a reflex force to the head. Concussions can happen in any sport, but more often occur in collision sports, such as football, rugby, or ice hockey. They're also common in contact sports that don't require helmets, such as soccer, basketball, wrestling, cheerleading, and lacrosse. Many concussions can occur outside organized sports. For example, a child riding a bike or a skateboard can fall down and hit their head. Symptoms of a concussion range from subtle to obvious and usually happen right after the injury, but some may take hours to a few days to develop. With most concussions, the player is not knocked out or unconscious. Symptoms may include headache, nausea or vomiting, dizziness or balance problems, sensitivity to light or noise, feeling dazed or stunned, feeling mentally foggy, trouble concentrating or remembering, confused or forgetful about recent events, slow to answer questions, changes in mood, irritable, sad, emotional, nervous, drowsiness, sleeping more than usual, or trouble falling asleep. Concussion should be taken seriously. After a concussion, it's common for many parents and coaches to ask when their child or athlete can return to their sport or to recreational activities. However, it's also important for parents to remember that children are students first and athletes second. Let's first talk about returning to school. As we discussed, a concussion is an injury that usually only temporarily disrupts the normal function of the brain. A concussion will usually disrupt a child's ability to think, concentrate, remember, and be efficient at processing and learning new school material. The first few days following a concussion, when the brain is still healing, a child may be too symptomatic to attend school. Brain cells repair themselves daily, so effects of the concussion should lessen and become more tolerable and manageable with time. When this happens, a child should be encouraged to go to school. Following a concussion, it can be very difficult for a healthcare provider to know exactly when a child is ready to return to school. For example, if I see a child on a Thursday, he or she may or may not be ready to return to school on Monday morning. Therefore, it's important for parents to monitor the child's symptoms and the physician to have close follow-up with the child to determine when to return to school. It is not necessary for a child to be 100% symptom-free before returning to school. When concussion symptoms have lessened and are tolerable for up to 30 to 45 minutes, a child should return to school. This will usually happen within a few days and certainly within the first week of the concussion. Prolonged absences from school following concussion is usually discouraged. Check with your child's school to see if your district or school has a policy or procedure in place to help students recovering from a concussion succeed when they return to school. Returning to school, however, does not mean returning to play. In order to reduce the risk of another brain injury, a child should be removed from school and club sports, gym class, dance class, and physical play at recess while they're recovering from their concussion. In addition, teachers should reduce cognitive demands. Supporting a child recovering from a concussion can benefit from a collaborative team approach among school professionals, healthcare professionals, parents, and students. It is encouraged that the family team help to facilitate feedback and information to, from, and between the school teams and the medical teams. We're all working toward the same result, getting the child back to school. Before a child can even consider returning to the field or recreational activities, he or she must successfully adjust back into the social and academic demands of school. So let's talk about sports-related concussions and returning to play. Every sport carries some level of risk, and even though not all concussions can be prevented, some may be avoided. Athletes should be taught safe playing techniques and to follow the rules of the game. Reducing time in practices that results in contact can reduce potential for concussive events. Most importantly, every athlete needs to know how crucial it is to let their coach, athletic trainer, or parent know if they have hit their head or have symptoms of a head injury, even if it means stopping play. Teach your child to never ignore a head injury, no matter how minor. If he or she reports one or more symptoms of concussion, or if you notice symptoms yourself, keep him or her out of play and contact your pediatrician as soon as possible. When in doubt, sit them out. Signs observed by parents can include your child appears dazed or confused, is confused about assignment or position, forgets an instruction, is unsure of the game, score, or opponent, moves clumsily, answers questions slowly, loses consciousness even briefly, shows mood, behavior, or personality changes, can't recall events prior to the hit or fall, or can't recall events after the hit or fall. Symptoms reported by the athlete can include headache or pressure in the head, nausea or vomiting, balance problems or dizziness, double or blurry vision, sensitivity to light or noise, feeling sluggish, hazy, foggy, or groggy, concentration or memory problems, or just not feeling right or feeling down. All athletes with suspected concussion should not return to play until they are free of concussion symptoms and have completed a return to play progression. This may require a written release to play from a physician. Recovering time from concussion is variable with each injury, but may be prolonged in athletes who continue to play immediately after their concussion. An athlete may feel better and want to return to play before their brain has completely recovered. Given the uncertain and unpredictable time frame for recovery, all former sports activity should be suspended until symptoms have resolved at rest. A stepwise return to physical activity can begin once the athlete has been cleared by their physician. Having an athletic trainer involved in monitoring this plan can be very helpful. It's important to pay close attention to worsening symptoms while completing the activity progression. Any concussion-related symptoms that return with exertion are a clear indicator that the concussion has not healed. Not all concussions can be prevented, but some can be avoided. Helmets should be worn for any riding activities such as horseback riding, riding an ATV, bike, skateboard, or snowboard, or contact sports. Helmets should fit properly and be in good condition. No one knows how many concussions are too many before permanent damage occurs. Never ignore a head injury, no matter how minor. There is no such thing as a mild concussion. You may have a concussion with mild symptoms, but you still have a concussion nonetheless. Repeated concussions are of greater concern, especially if each one takes longer to resolve, or if a repeat concussion occurs from a light blow. The best treatment for a concussion is reducing physical and mental activity. Children should be monitored often, but there's no need for wake-up checks during sleep. School attendance and work may need to be modified with tests and projects postponed. Students need to be excused from gym class or recess activities. Light physical exertion may be recommended to improve recovery. In some cases, physical therapy may be needed as some problems associated with concussion may need active rehabilitation. There is no one-size-fits-all treatment for concussion. Just as every child is unique, treatment plans need to be tailored to each individual. Thank you, and I hope I was able to give you some helpful information about concussions. If you would like, you can also visit the website healthychildren.org to find out more information that is very friendly and easy to read. Enjoy your day and stay safe, my friends.